Welcome back everyone to the HipTrack YouTube channel. This is part 2 in a 4-part series. We're talking about mobility exercises for your hip when you have hip osteoarthritis. In this case, we have Jessica kneeling on a couple of pillows. That's to protect her knee. A lot of people have sensitive knees, so you want to put a pad or something down there just so it feels more comfortable. She's going to put this foot out so that her shin bone is sort of out this way, a little bit at an angle. And then what she's going to do is we're going to try to target the front of your hip joint, your hip flexors, part of your quads, and your hip joint capsule. A lot of people will get a restriction in the front of their hip, and when you try to stride out or walk, and you know what I'm talking about when you have hip arthritis, it shortens your stride and you get pain in the front every time you try to walk out. So to help with that hiking and walking and whatnot you want to do, this is a really important movement. Now when you don't have hip arthritis, you should feel a stretch just in the front of your hip somewhere in there. When you do have hip arthritis, you're going to get that same stretch, plus you'll feel this other thing. And again, you'll know what I'm talking about when you do both sides. It's totally safe to feel that. You're not damaging your hip. Just make sure you keep that pain down again to that 1 to 2 out of 10 and not a 4, 5, 6. So what she's going to do is she's going to tighten her stomach and her left rear end and sort of thrust forward so that her knee comes to about here. And at that point, you can see how her knee is moving behind her body, or her body's moving in front of her knee. Now she's going to hold that tight. Now if somebody came along and just saw her, they would think she's just kneeling there. But on the inside, she'll tell you that she's sort of wound up so that she's feeling that stretch through here. Those muscles start here. They actually go through your body and they attach to your lowest thoracic vertebrae and all of your lumbar vertebrae. So this is an important stretch for anybody with lower back pain to do as well. And we know when you have hip arthritis, that definitely affects your lower back when you're walking and trying to do activity. So again, really important exercise. We'll call this the hip flexor stretch, but it really is for improving your hip extension. Thank you very much.